Can we come to order, please, ladies and gentlemen? Yeah. Thank you. Good evening. I'm Councillor Maureen Cleater, the Chair of the Housing Community Cohesion Policy Advisory Committee, and I'm pleased to welcome you to this meeting. The meeting will be broadcast live and recorded for playback on the Council's YouTube channel. Will anyone else be recording the proceedings? I ask so that people at the meeting will know if this will be happening.
I will be making an audio recording of tonight's meeting.
You reserve your right, yes?
Yeah.
Yeah, thank you. If the fire alarm sounds during the meeting, please remain seated and members of the Democratic Services team will assess the situation and give further instructions on the evacuation of the building if necessary. So we move to the agenda. Item 1, apologies for absence. I have received apologies from Councillor Rodwell and Councillor Parfitt. Thank you. And I have not been notified of any substitute members. There are no urgent items on the agenda, and looking at the empty stalls, I can see we have no visiting members. Item 5, are there any disclosures by members or officers? No. And are there any disclosures of lobbying? No. We're whistling through this, and as Liverpool are playing at home tonight, I could be lucky and catch the second half. And Maidstone United are playing, I believe. Other football teams are available. Item 7, to consider whether any items should be taken in private because of the disclosure, possible disclosure of exempt information. I move that all items be taken in public. Is that agreed? Thank you. Item 8 are minutes of the meeting held on the 14th of January 2025, and they are in pages 1 to 6 of your pack. Are there any comments on the accuracy of the minutes? I move that the minutes of the meeting held on the 14th of January 2025 be approved as a correct record and signed. Is that agreed? Thank you very much. We now move on to item 9, which is the forward plan relating to the committee's terms of reference, and they can be found on page 7 to 10 of your pack. Are there any comments on the forward plan, or do the cabinet members wish to make any comments? Okay, thank you. I move that the forward plan be noted. Is that agreed? Thank you. Item 10 is Preventing Financial Exclusion Action Plan Update 2025. They are on page, or that report is page 11 to 38, and there are 2 recommendations on page 12. This item will be introduced by Councillor Nagy, the Cabinet Member for Community Cohesion and Safety. And the officers present are Anna Collier and Orla Sweeney, who may come in on this item. Councillor Nagy.
Thank you, Chairman. Good evening, members. This report presents an update on our Equality, Diversity and Inclusion Action Plan, which is crucial for ensuring fairness and inclusivity across our community. As mandated by the Equality Act 2010, we are committed to upholding the public sector equality duty, and this plan is a key part.
Sorry, Councillor Nagy, just 1 second. Are you speaking on the right item?
Oh, I got the wrong one. I'll have to read that again. Okay, this is one.
We've just had a precursor of your next one.
It's all right. I was prepared. I was prepared, but we just got number one wrong.
Here's one you prepared earlier.
Here we go. This evening's report provides an update on our Preventing Financial Exclusion Action Plan, which aims to support residents facing financial hardship. The strategy accompanying action plan was put in place by the previous administration, has been carried forward by the current administration, demonstrating our continued commitment to this crucial area. The action plan addresses the evolving challenges of financial exclusion, particularly in light of the ongoing cost of living crisis. Our approach is holistic, focusing on four key priorities: access to financial services, maximising income and debt advice, recognising the impact on physical and mental well-being, improving chances through education, skills and employment, tackling food and fuel poverty. This report highlights the significant progress made, showcasing the positive impact of our collaborative efforts. We have seen tangible outcomes such as increased income for vulnerable households, enhanced support for those experiencing domestic and financial abuse, and opportunities for residents to receive tailored and specialised advice and support. The action plan is a great example of how cooperative, can't say that now, cooperative working both across departmental and with local partners can achieve meaningful outcomes for residents. The report also outlines our action plan for 2025-26, which includes new initiatives to better understand financial exclusion in the borough, support the voluntary and community sector to make better use of their resources, and target specific demographics of residents for upskilling and job opportunities. We are committed to building on our success and ensuring that our residents have access to the support they need to thrive. I'm happy to take any questions, and officers are also available. Thank you.
Thank you, Councillor Nagy. Are there any questions on this? Councillor Dawes?
I've got several questions on the paper. First, I want to commend, I mean, there's a lot of great stuff that is being said here. So we're trying to help people with their finance. There's a community project about food offerings, about employments, about getting started fund for when they're leaving temporary accommodations. So there's loads of great stuff, and there's even a training for trauma awareness for the frontline staff. So that's all great stuff. Lovely to hear. But I have a few questions. The first one is on page 17. Right at the bottom of the page, we're talking about who will benefit the targeted intervention to address health equality. I mean, you have a health inequality. Who is it that it will benefit? How do you find it?
Sorry, I was waiting for you to run through all of the questions, not... So, who's going to benefit from health inequalities?
How do you find those health inequalities? Because there is charity out there where people are saying, I'm not being seen by doctors, and there's no routes to actually refer them to. So how do you find out where's an health inequality? Where does that come from?
Sorry, right, thank you. So we have a health inequalities partnership grouping, which has recently been formed, which involves a number of different organisations from across the borough in different aspects of health support. And what we've brought together, and we've started from a data-led approach essentially, is we've looked at data held by different organisations, including public health, including ourselves, other organisations, to identify where those different organisations are seeing health inequalities. So that might be different areas of the borough due to lack of services in the borough. It may be different groups of people because they may not be able to access services or because their health needs are higher. And we're using this data plus information we're aware of to pull together an action plan to target different areas. Do you want me to hand over to you, Orla, to talk about it in more detail, the action plan?
So the action plan is under development at the moment. We had a number of organisations come together here to talk about the local priorities for their service areas. So people working in the voluntary and community sector, people working at KCC Public Health, mental health services, people from across the borough that have access and insight to our wider community and the people who are affected by various different things. So perhaps maybe, I'm just plucking this as an example, we know that young children, young people, their mental health is very affected because they've gone through a pandemic. We know that their need is greater and perhaps not being met with the resources available. So how can we all work together to make that a priority for Maidstone and achieve more for our residents by that collaborative working? So that could be one example that we're all very, very patently aware of because we've all been through that experience together, and it's our children or our grandchildren that we're seeing affected. And there's numerous other examples. Access to GPs, perhaps people who are digitally excluded can't access GP services, so what can we do to make that easier and more accessible for them? The action plan, as I said, is under development. We've had our second meeting, we're bringing experts in, we've got people talking to each other, and it's been extremely well received because those conversations often happen in silo, and now we're together working for outcomes for the community. So I hope that provides some background.
Thank you, Ola. Thank you, Anna. Councillor Dawes, how many questions have you got?
I've got rather a few. But if anybody wants some,
No,
some questions in the meantime, so
no. I'm just thinking it may be better and easier if you ask your questions. Did you say 4, 5 you had?
I can probably do 4, 5.
Yeah, if you ask your questions and then the officers can respond, because some of them may or may not be interlinked.
Yeah, it's just these service action plans. I was talking to another charity that works within Maidstones, and saying, have you been invited to this particular conference that you was talking about? The inclusion board, and it's like, no, we haven't. And I say, are you aware that they're trying to reduce health inequality? And I say, no, really? How do we do that? Where can we refer peoples?
So I think that's a bit of a jump ahead to where we are. So it's a very early stage. The action plan isn't completed yet. You could invite every single organisation that works in Maidstone. You wouldn't be able to get past getting something developed. So we need to work with a small cohort of people that have really good data and good understanding and have power within the health sphere, which we're limited even with our power to do that. So we can develop the action plan, so then we can look to engage people and make proactive steps out. The Inclusion Board isn't a conference. It's an internal board which we've started to bring key organisations into. So initially it was an officer-based group, and then we've moved to bring in a small number of organisations, and so we're developing that as we go. Orla, do you know which organisations are attending?
That's what Councillor Dawes... What constitutes getting on this priority list of organisations, I think, is where you're going, Councillor Dawes.
So as Anna said, it was very much an internal group, and actually responsible for the first iteration of this strategy after, and in response to COVID, and as it's developed, we now have Fusion, the chief exec of Fusion on there, so it's at that level, the chief exec of Involve, and the chief exec of Age Concern. And it may not stop at those organisations, it's very likely that it won't, but that's where we've got to so far in terms of the work, the joined up work that we've been...
Sorry, can I just clarify, is that Age Concern or Age UK?
Sorry, that would probably be Age UK.
Yeah,
CAB.
Oh, my apologies, and CAB have been there from the start, the Chief Exec, Paul Hardy.
it's very much a strategic level, not
Very
at
much,
that lower
very
granular.
much a strategic level board, yes.
So
Correct.
I think where Councillor Dawes, I'm sure you can speak for yourself, but I think she's looking at where that granular lived experience is going to be fed through, because data is one thing and it's great, but it's data. And if people are working on the ground and noticing something else, so I think that's where you're going with that, Councillor Dawes, and when we'll be getting to that, if you like, once we've got the strategic view going.
So I would say we have our voluntary and community sector bi-monthly forum, and there's no doubt that we will begin with all of the Healthy Alliance be working towards bridging that gap and those feeding in upwards and downwards. But if you're working for an organisation in the voluntary and community sector and you're not represented at our bi-monthly forum, I'd encourage you to come, because that's where the insight comes from, where the local knowledge comes from, where things are fed down, and then obviously things are fed upwardly from that forum also.
I'm no longer working for an organisation within Maidstone, but I'm thinking about all the other organisations like the Day Centre, the Salvation Army. There's loads of people out there that are doing something, the Hungry Heart. They're all organisations that are working to do something, and they don't seem to be invited, don't seem to be feeded back what information.
No, we have a single point of contact for the voluntary community sector where we send out regular communications about anything that's happening across our work streams and service areas, from funding to information to insight, and that's a two-way channel of communication. And our voluntary and community sector forum includes, the invitation is sent to about, I think, 170 organisations across Maidstone. So those that you talk about, we're in contact with, and they're invited to attend. We have a spotlight session at every meeting, which helps inform other people of the work that people are doing that they're sometimes not aware of within the sector. So it's something I think that we can tell you more about, and then perhaps you can share that insight where you feel you need to.
Could I just ask members of the committee, would that be useful information as members of this committee for you to have? Just so we're aware, because obviously we get people coming to us, and if we all know our individual organisations, and you know what goes on in Marden or Coxey's will be slightly different. So I think that would be a really useful information around that VCS fortnightly meeting, that, you know, if we've got people come to us saying, well, the council's not doing this, we can say, well, your organisation needs to be, you know, making contact. Would that be useful, everyone?
And we'd certainly welcome that, because what we want to do is build that repository as much as possible. And if there are people that we're not communicating, my goodness, we want to. So yes, thank you very much.
Thanks, all. That'd be really helpful if that information could be sent round. Councillor Dawes.
Yeah, I had another observations when I read the Appendix 1, that there's a service apparently on Trinity House to do with psychiatry. Been running for the entire year of 2024. Well, Madam had absolutely no idea that was a service that was actually provided by Trinity. And when I asked the Day Centre, they say, oh, that's great. When was they going to tell us that was available, and how can we refer anyone?
Sorry, which service was that, Councillor Dawes?
Sorry, what was your question?
Sorry, the acoustics in here are really bad when you're up here. I couldn't quite hear what you said. Which service at Trinity?
Psychiatrist consultancy in Trinity House. Once a week, apparently, in Trinity.
That's been available for quite a while. I only know that because they were talking about that when I worked in the NHS, and it was more about getting people access to people who wouldn't go to, for example, Albion Place, because they didn't like it. They didn't feel, you know, it was a bit too institutional. So it was a case of, well, actually, the staff need to go to where they are while they were accessing other services. And I think that, is that correct?
Yeah, it's not an open service to anyone. It's specifically within that housing service.
Thanks for that clarification, Anna. There was a lot of people with complex needs who were struggling to engage, and that's why that service was brought in, was my understanding. And to be quite honest, I used to work in Albion Place, so sitting in those waiting rooms, if you're really struggling, is not great. So it was just to take it down a notch, you know, for people who need that sort of support.
It's just trying to think about if you're a charity and you're dealing with somebody that telling you bluntly that they have real mental health struggle and they are potentially a danger to society and they're trying to recluse themselves to their own home, is how can you tell them, actually there's potentially some help, but you need to go and see your housing officers. It's like,
Yeah, it wouldn't be for that purpose. It's very specifically within our realms of responsibility of housing, and I think unfortunately we can't provide that level of services for the broader public. So we have to then call upon those that provide those services elsewhere.
So the NHS need to do their bit, but also mental health social care, for example, is KCC's responsibility, of which it's being cut again. You know, but clearly, anyone who's tried to refer anyone for help on mental health, it is a complete nightmare. It's a broken system, and the sooner we get it fixed. Is anyone in this meeting, officers? I'll bring you in a minute, Dinesh. Know who the Borough Council rep is on the ICB? We haven't, no, I don't think it's our council. I think it rotates, but it may be worth asking them to raise those issues at the ICB, where districts do have representation. It's chaired by Roger Goff.
I would say, so the health policy officer sits in my team and she supports our chief and our cabinet member at a number of forums. I know for some of the ones I've been to, mental health has certainly come up, but I can go away and come back to you with a clear map of the boards that we are on, including that one, and let you know who the representatives are.
Yeah. However, there are district councillors on there representing all districts. It used to be Councillor Mockery Cox from Gravesham, and I know Councillor Harrison from Swale was on it. I think the point I'm making, if it's at that level where stuff's not being done, we need to link into that to get that level sorted. So if you could look at that all, that'd be really good. Councillor Katka.
Thank you, Madam Chair. Page number 18 on the pack is it talk about the bread and butter things initiative. I believe that's the new. It's going to substitute the existing larger one. It does talk about the another two area. Oh, sorry. Page number 18 on the bread and butter things initiative. It talk about there are two areas probably going to be included. Have we identified those areas? Thank you.
The bread and butter thing, you've said we currently do Trinity, Shetway and Parkwood, and in there it says there's likely to be expanded to two other areas, and Councillor Cadker's asking.
I'm sorry, I couldn't quite hear you, but yes, I can answer that question. So, yes, so what's going to happen is as part of their grant agreement, they're going to come in and they're going to come into the three areas where we've been supporting residents to date with our offer that was funded from a grant from the ICB. And as part of the grant agreement, we want them to move into two further areas of need. And once they establish themselves in the three areas, they will then work with us to establish where those areas of high need are, and we'll work with them to make sure they get there. So that will be data-led, insight-led, to make sure they're going to the right place where there isn't something already there and that need exists. So we will keep you informed on that, and that's going to be obviously a piece of work that starts and continues throughout the next municipal year.
Councillor Dawes.
I also read on page 23, along with the housing and inclusion, that at Trinity House, it's offered debt management via the Citizen Advice Bureau visiting Trinity House. Some of your partners that you're partnering with was not aware that there was even a service offered by the Trinity House. Is that sounds like, is it because, same again, is it only in-house and you can't refer people?
So yeah, again, it was a housing CAB joint project together. So they did a trial year, and then now we've been able to access funding to fund them for an additional year. So we would need to come review at this end point, and then see if it's something that we can do beyond that. Though we do, for example, have our welfare officer who works within Orla's team, who has also been able to refer into that service. But I think it's a capacity-based issue. We couldn't extend it too broadly because it's a very limited capacity, and its main focus has been avoiding homelessness, essentially.
So, in light of that question you've just put, for example, I know um, in Staplehurst, there's the Staplehurst Debt Centre that's run by the church there, which is an accredited organisation which, when I worked at KCC, if we had people who lived out that neck of the woods, you would refer them to. I think certainly for those in the outer areas find it more problematic. Step change, everything is online. Christians Against Poverty, if you live in the right area, you can have someone come and visit you. But I think with a lot of debt help, it's tailoring that to what the person needs. And obviously, KCC have moved all their staff over to do just charging for care now. So they've lost all their benefits officers, which people who had complex mental health needs, they were the officers who helped them. So again, we haven't got the resources to pick up everything that KCC has cut. Orla, please come in.
I just thought I could add to that, just in the sense that our welfare officer post, in the same way that, in the same vein with the voluntary and community sector lead, we have mapped as much of the resource, and we're constantly trying to develop that resource about where the debt advice and where the extra advice is, so that when somebody does approach us, we can signpost them to something in their area. So we have got a substantial resource that we use to support residents. And I think, as Anna was going to say, the CAB at the Inclusion Board update us quarterly on their work, and we can see visually from, the mapping of where the people are, that it's across the borough, right out to Staplehurst and beyond. So that's really positive to see that people aren't being left behind.
I think the other thing we need to do on debt as well, and I think every one of us will find it, people just put it to one side. There is always a waiting list to get help. So the first letter you get, we need to encourage people to seek help then. I've always found it, if at least you can help someone do a budget, and the National Debt Helpline has a really good free budget sheet, that's usually the first step. That if you do that work with them, they can then go off to a debt charity and say, look, this is what I owe, and this is what I've got coming in, and I can't manage it, and you need to help me sort this out. And if that's the stuff that can sometimes take the time, but I know we've had people pop into our surgery to get help with that, and that's the bit they struggle with. You know, A, they haven't got a computer, and B, understanding that. I've got one question or suggestion regarding the larders. Obviously, when the new contract starts, we need to monitor that, and we've discussed this in Chair's briefing. So I would like to suggest from the Chair that we just have an update, can be a verbal one, say 3, 6 and 12 months on how that's performing, and whether there's a better uptake or whether there's a lower uptake, and whether there's an expansion. And as I say, it doesn't need to be a written report. We can have a report back to this committee. Would members find that useful? Yeah, is that all right, Orla, if you're able to facilitate that?
Just to reassure you, rather than a contract, it's a grant agreement, but that has been written into the grant agreement, and just as part of a wider piece of work, and the work we've done to support this transition, we've mapped all the food resources across Maidstone by ward, and we're approaching them to find out who they're supporting and that numbers, so that we begin to understand the need and where the gaps are, and that will form part of the monitoring requirements within the grant agreement and add to that body of evidence that we so desperately need to support everyone. So,
you know what I'm going to say now, I'm not going to go into figures or whatever, but obviously there is a change in the cost of using the larders, and we need to see whether that's having a detrimental effect on people who were using the larders. So as long as that's taken into account, because that was the concerns that were raised. But obviously the funding had all changed. We knew it was coming. It was this or nothing, but we need to make sure what money we have got we're spending in the right way to help people. But thanks for all the work you've been doing on that as well, Ola. It's an enormous task, and sometimes thankless. And I look forward to the meeting on Friday. Councillor Dawes, anything else, or are you all done?
Oh, I had only a little comment. I mean, I'm sorry, I'm picky, but I think my job is to read those papers and make my comments. And my comment is, I read the same information throughout the pages a few times. I read it on page 15, and then I read it on page 23, and then I read it again further down the line. And then I'm thinking, I am that daft and I need to be told 3 times the same kind of information? I don't know.
Take that on board, but also I'd like to say that that shows that some of the actions we're taking cross a number of different areas, and that demonstrates, whilst it might be irritating to read it sometimes, it does demonstrate that when we're picking up projects that we are recognising that they do target different things. So perhaps take it in that spirit.
Do we agree the recommendations, but with the request made to Orla that we get the report back on the uptake and use of the larders? Agreed. Thank you very much for that, and thank you for the work that went into that. Right, part 2, Councillor Nagy. It's the Equality, Diversity and Inclusion Action Plan, and unlike Donald Trump, we've got one.
Thank you, Chairman. Thank you, members. This report presents an update on our Equality, Diversity and Inclusion Action Plan, which is crucial for ensuring fairness and inclusivity across our community. As mandated by the Equality Act 2010, we are committed to upholding the public sector equality duty, and this plan is a key part of how we deliver on that commitment. Our EDI policy is built on 3 core objectives. Community leader, to lead by example to ensure every individual resident is connected and supported. Employer, to lead a diverse and inclusive workforce that is reflected of the Borough of Maidstone, where residents and colleagues feel safe, confident and empowered to challenge and bring about change. Service provider, to deliver inclusive services in accordance with the Council's values. This year's action plan builds on the progress made in 23-24, which was significantly informed by our first EDI staff survey and the development of key strategies such as preventing financial exclusion strategy and the workforce strategy. As a service provider, we are focused on using neutral spaces such as Trinity, the Eco Hub and the community larders to provide accessible face-to-face support. Work has also restarted to officially launch Maidstone as a compassionate borough. As an employer, we are investing in training programs that promote respect and inclusivity, as well as creating more meaningful communications channels for our staff. We've also taken steps to ensure all new members have equitable access to support and resources relevant to their role. As a community leader, we have supported initiatives to engage underrepresented groups and will continue to work with them to develop knowledge and understanding. We have also grant funded a number of projects in the voluntary and community sector that addresses key issues such as mental health and food poverty. The update action plan for 25-26 includes new initiatives such as implementing a programme of citizens' engagement, including a citizens' assembly on violence against women and girls, undertaking a review to better understand areas of inequality, and impacts in the borough related to the effects of climate change, rolling out staff guidance on the use of inclusive language. We are committed to driving positive change, and this plan reflects our ongoing efforts to create a more equitable, and inclusive borough for all. I'm happy to take any questions, and officers also. Thank you.
Thank you very much, Councillor Nagy. Do we have any questions from councillors? Councillor Dawes?
Yeah, yeah. So I was reading on page 44 in the 2.14 that you're saying that you want to no. So, on the view that homeless and prevention project continue to be delivered with a new pilot of court and substance misuse, the team is also seeking to expand a new court relating to family evictions. I mean, would you like to expand on whether that is new? Is that started recently? And how do you want? Yeah, I'm a bit confused.
I can give you a high level, and then I would say that I would take a step back and then ask housing to step in and do the detail on it, because obviously it's not project running in my area. So of course they have to work within that area the whole time. So this isn't suggesting they are not working directly with these people, these different cohorts. But very specifically, they've been preeminent nationally in using a system called One View. It may have been presented to this committee before in the housing strategy, homelessness strategy, and that system, they have been working with Zanshura, the organisation that set up that system, to use it to target different groups. So family cohort has not started yet, but I understand at the moment what they're doing is working with Zanshura to shape that, to be able to run that out as a project to target those groups. I can't give you any kind of further information on what that actually looks like because I'm not part of that project, but we could always ask them to come and speak to the committee or provide an update outside.
That's helpful, and I would suggest we get Mr. Littlemore to do a response on that.
Well, it's great. I understood it's starting. They're working on it, so that's where the expansions words came from. That's brilliant. On the same page, there's a community ladder. You're talking about the council alongside inclusion board partner will develop a team of channel platform to facilitate an information sharing, signpostings, engagement of single point of contact. Is this new? I'm confused because I thought we had disbanded a team and was asking the bread and butter things to run their show. But now we are saying that we're going to have an inclusion board and redoing the signposting in a different way. I don't get it.
So I can't see that on page 44.
2.16.
Right, okay. So I can explain that actually.
Can I just clarify, that's community leader, not community larder. Yeah.
Okay, does that make a difference to the question?
I think it does now. Leader.
Yes, just to facilitate good communication and information sharing.
bring Councillor Wilby in and Councillor Oliver because they haven't spoken yet, and then back to you.
Yes, thank you, Chair. It's just a quick one. Good report. Obviously, working towards what obviously we should be doing. I'm just curious about how we judge that we are compassionate. On Appendix 1, page 52, which says we will work towards becoming a compassionate community. How do we judge ourselves or on that? That's all.
So the Compassionate Maidstone project's been going, well, it's something that Heart of Kent Hospice have been very passionate about for some time, and it's something that's been talked about pre-COVID. There is a charter that came from the health industry, I think, which you can adopt as a borough or whatever kind of makeup you are in your district, and it involves bringing together all your kind of anchor institutions and everybody aligning to this charter. It's quite a big piece of work, and it's really about bringing about long-term social change. So key offices within Maidstone Borough Council are part of a project board with the Heart of Kent Hospice and other public sector organisations, and we've undergone some training with the people responsible for this way of working, this charter. And at the moment, the project, I'd say, really is quite in its infancy. The Heart of Kent Hospice have started some compassionate cafes, but what it's about really, I suppose, is bringing a healthy understanding and acceptance of death and dying, and bringing that into our communities. It's quite, I suppose, it's quite simple, but yet it's quite complex, and it's something that we could share more information about. It's quite exciting, I suppose. I hope that answers some of your questions, but it really is the Heart of Kent Hospice at the moment that are leading on this, and it's very early days.
It also involves the changing of policies, I think, as well. That's a kind of key thing, which is why it can be quite difficult to get some of the change around, because you would need to review all of your policies to look at things like bereavement leave and how you take account of death, dying, long-term illness as part of your working practices.
All fantastic things that we're doing. However, the key point I did ask was about how do we rate that? Is there a KPI that we do against? We tick ourselves against the charter to say we've ticked those boxes? Yeah, because obviously I'm just aware that that can be one person's idea of compassionate compared to somebody else's can be quite a broad area. So I'm just wondering, are we self-assessing, or do we work with other charities to say assess us on this? Yeah, peer review.
So there is basically an action plan you have to follow, and you would have to meet all of those different elements of the criteria.
Thank you, that's useful. Did you want to come? Don't wave at me as though I'm leaving on a boat. Do you want to come in on this particular point, Councillor Nagy?
Yes, I do.
Yeah.
I had a talk with the Heart of Kent this afternoon, and they're very keen to push that idea forward, and I'm very keen to push that forward too. But obviously that means a lot of work for officers, but it's something I think if we can achieve it would be a great benefit to the borough. So I'm very, very keen to push that. Thank you.
Thank you, Councillor Nagy, that was really helpful. Councillor Oliver?
Thank you, Chair. Yeah, it kind of links to that. So on all of the action plan, we've got an objective, commitments, action title, action, responsible service, timescales for delivery, and then, yeah, I just feel like it's missing like the KPI or the metric that we're going to measure it against. And I'm sure most of this is really top line, and then once you get into the detail, you get that KPI and metric, but it's more about targets and like if we're meeting them, when we're meeting them, all of that boring stuff. Yeah.
Yeah, we can go away and look at some KPIs alongside it. Some of them will already exist in our different sets, but we can add some in, no problem at all.
Thank you very much, Anna. Councillor Dawes?
On page 44, they say, as an employer in 2.19, then biannually the staff is surveyed to deliver with a continued focus on cost of living. So I imagine it's for the cost of living crisis. Why is it only the employees that are being surveyed, and do they need to be surveyed twice a year? Could it be open to other people?
Biannuals every second year, and I think that's with reference to the staff survey. And in terms of residents, we have a biannual resident survey which asks the same question. So we're gathering that data, and we've got that trend.
And that's less often than KCC survey their staff, but it does pick up a lot, and that informs pay negotiations and targeting of lower paid, because none of us should be organisations that have staff that have to claim universal credit. Spoken like a good trade unionist here. Anna.
Just while we're on as an employer, previously we've had actions in there related to members. So I was curious to ask a question of committee as to whether there was anything additional that you think should go in as members, whether you think there's anything we've sort of missed previously.
I think it would be quite interesting to hear from staff what they feel their interactions are with elected members. Good or bad. No, I think it's been an issue elsewhere I've worked, and I think it's really important because people have really good relationships and good, if you like, co-production and helpfulness, and it tends to be people in democratic services who have the most linking. But actually there are other people out there as well. And I know when the Suez crisis was on, we had the public on one side and we had the employees on the other, both of whom were speaking to elected members. But in all seriousness, behaviours from councillors are really important, that we actually behave in a way that we would expect our employees to behave, around respect, around dignity, around inclusion. That would be my thought from the chair, Anna, but I'd welcome other councillors whether they think that's a good idea or not.
No, I think having worked with some very difficult councillors, I think that feedback would be helpful on both ways. I think also being a two-hatter with the parishes, I know the parishes do really suffer with sometimes that kind of communication backwards and forwards between their employees and their staff. So I think that would be especially seeing we're talking about possibly doing a town council, that kind of feedback would be beneficial. And I've also got another quick question. You mentioned about the voluntary community sector biannual meeting. Is that only aimed at people for the financial side within this, or is that meant to be across the board? I only ask because, like some other people, I sit on some voluntary groups, and we've never been invited to that. So I'm not going to say who they are now. I'm quite happy to give you those names after. I'm just curious, is that open to all voluntary?
I think it's quite. I'm assuming we're talking about the same meeting we were talking about under the previous item, the VCS bi-monthly forum.
Yeah.
And I think hopefully we can achieve that together with the action from the previous item about you sharing your knowledge of groups that you think. It's definitely open to as many as possible.
Okay.
And we actually have done a piece of work in previous years to try and identify those gaps with a member working group. So yeah, we'd love to take that forward with you.
I'm aware that my one that I work with is more like a nature reserve, but most of the people who come to that actually come there for the social side of it, and mental health. It's not really, they don't come for the outside, it's to come to see people. Actually, that may be their one interaction. Such so, it'd just be an idea to obviously reach out to some of them. I know what I was going to maybe propose. In the past, we did have a nature forum to go with it, but we actually invited all the nature reserves in. That's kind of fallen off. I know probably because the uptake wasn't that great, but potentially if going forward we could have that again, because there's a lot of nature reserves work over the borough that do other stuff, not just the nature side of it, that could help, but also could have that interaction between each other. Okay.
Thank you, Councillor Wilby, that's really helpful. Yours?
Yeah, I've got another question. On page 45, 2.21, you're saying that the council has established and offered a trinity to provide debt and housing and welfare, and you together you take this offer to other area in the community. I was wondering, where do you take it in the community?
So the welfare officer and the debt advice offer happens on a Tuesday, actually, when the community larders have been happening. And it's working really, really well. You've got people coming in that need that wraparound support. So that's something that we want to continue building on. So obviously it works very well at Trinity. There's a need there. And the conversations have started with Fusion Healthy Living Centre in Parkwood, and them supporting a similar offer in Shepway. So it's an ongoing conversation, and it's something I think people recognise and talk about more. We see it, don't we, as an almost USP with companies advertising at the moment, taking things to the community. So it's a wider piece of work, but something that we're supporting, and our welfare officer is out there doing that, and then we'll just continue to build on that with the voluntary and community sector.
Yeah, and I think what people are getting at is that's great for those of us who live in the urban bit of Maidstone, but we also need to remember the more rural areas, because that's really the hidden deprivation, if you like, and people really struggle.
So we have had the cost of living roadshow that's gone out to the rural areas, and when we talk about the two other areas that we're moving into with the food offer, rural areas obviously will be looking at all of those places. And yeah, this is just the start, but we would always look to all of the areas and not be town centre centric.
I think for those of us who do represent the urban area, we are also very mindful about the rural areas, and I'm looking at who's on this committee, and there are not, you know, a lot of people from the rural area, so we just don't want those forgotten. Councillor Nagy.
I just wanted to thank the officers who were involved in the action plan and the financial update report, because there's a lot of work gone in there and a lot of detail, and you know, they shouldn't get shouted at if they're not doing anything. But I think these were two great reports tonight, I think, and I just think like to have their thanks noted in the minutes. Thank you.
Thank you, Councillor Nagy. I'll make sure that's noted, and I think we all appreciate the reason you're getting so many questions is that you've provided a really in-depth report that we can really drill down and ask, which, you know, can be a pain sometimes, but actually it's really good for democratic accountability. So, on that basis, are we happy to accept the Equality, Diversity and Inclusion Action Plan update? Agreed. And again, thank you very much to the officers for the work done. We now come up to the third quarter finance update report. That is on pages 59 to 70, and the recommendations are on page 60, and Adrian is going to tell us whether we need to ram raid a bank to be solvent, but I have absolute faith in the council's finance team that we are actually a very fiscally prudent authority. Adrian.
Thank you for your comments, Chair. Nice to hear that. So before I get into the particular finances of this pack, I'll just give you a quick overview of where we are in terms of the whole of Maidstone. So last quarter, we were talking about an overspend of about 449,000. We put sort of key controls in terms of trying to reduce spend on where we can. And also we looked at recruitment to try and pause that as well as possible to reduce spend. So currently at quarter three, we're looking at an overspend of about £49,000. So really good improvement. So good news in the sense of the control of the spend. In terms of this pack, sadly a bit of the other way around. We've increased the overspend from about 450,000 to just over 800,000. same areas of overspend that we've had in the past, and nothing really new or different, just continued pressure on TA and associated costs around there, and some additional one-off loss of income related to Granada House while that's still being refurbished at the moment. And obviously that's taken a little bit longer than we'd hoped. On a couple of those, certainly the TA, we've, as part of next year's budget, we've tried to make sure we reflect some of those pressures in that, so hopefully we don't see quite so much. I'll quickly touch on capital, because also that some of that spend is hopefully also trying to negate some of the TA spend as well, in terms of trying to buy our own properties so we can not use the expensive nightly paid, and hopefully also put people in better accommodation as well. Overall, though, there is a slight underspent, so but good position. We spent about 28 million, but looking like about nearly a 6 million underspend. Some of that is due to slippage in some of the planning permissions around Maidstone East and other schemes like that. But obviously, its planning permission has got in approved for Maidstone East and now also Springfield, so they're progressing. They're just either gone to the market in terms of trying to procure the people to do the detailed design and then obviously the build, and Springfield is very close to starting that as well. Part of that spend as capital as well is purchasing the TA properties. So the team have done really well. So at the moment we've got 78 identified out of 80. 62 are legally complete. Some are still going through the legal process. Sadly, the legal process with the government in terms of all the basic things we all go through the house building are taking a bit longer, just because that's where we are at the moment. So, which is good position. And we will continue to buy sort of another 80 next year that's been approved as part of the capital programme. So we do hope that will also relieve some of the pressure on the spend, and as I said, hopefully provide better temporary accommodation for people going through that at the time as well. So that's sort of key points from me, but happy to take any questions.
Thank you very much, Adrian. And temporary accommodation is a massive pressure on all local authorities who have responsibility for housing. And I think the purchasing, leasing, whichever way we're going to do it, of temporary accommodation is the way to go. Just a shame in some cases we're buying back houses that used to be our council houses, but you know, it is what it is. We are where we are. And I think that's the way to go rather than use expensive temporary. And wherever possible, you know, we should not, doesn't matter which council you are, wherever you are in the country, it is always best to keep people close to their community rather than place out of area, because that increases the complexity and vulnerability, especially if the family's got young children, you know, with schools and that. Do we have any questions for Adrian? Councillor Dawes.
I've got one question. Is there any blockage to, or is the process of trying to get those houses up and running have been progressing as good as you wanted, or is it slowing down? Because I was kind of understanding from another councillor that maybe those houses by now should have been able to be placed with residents in, and the process have been a bit slower than expected.
So I think it's going as fast as we had. So originally the plan was to do 80 houses over 3 years. We squashed that down to 2, so they've managed to deliver on that, which is good news. So just it's taking a little bit longer just because literally the deeds you need to get signed by government to hand over the house to you is just taking longer. So that sort of, it's not our legal process that's taking any longer, it's that other bit. I think the key bit that we are keen to do is related to the quality homes bit, is where we want to then really add the value, is because at the moment we'd like to take people out nightly paid into our temporary accommodation, but once we've built homes we can hopefully then get them into our own social housing, which will then hopefully formally remove them from that cycle. So that's what we're hoping to do, and that's what the plan is. So fingers crossed we'll be there soon.
Thank you.
Do we have any other questions? Well, thank you for, again, a very full report on the financial. We know there could be slippage in Q4, you know, we don't know what's round the corner, as it were. My only other comment is, maybe as an authority, and it's probably something I should talk to other people about, is around the number of empty properties in this borough that have been empty for a considerable amount of time. And we need to think about looking as a council how we bring them. And I know part of the issue is, because we've discussed it before, is who owns them. But if houses are being left to rot, then, you know, but we've got our planning expert with us, Councillor Wilby.
So coming on one question then, obviously talking to a lot of planning developers, obviously in my role, I know the smaller SMEs are finding it quite hard for the housing associations to take on their homes because they're small numbers. Is that something we as a council could look about actually taking on so that we actually increase our housing stock with new build houses rather than looking at buying existing houses?
So I think for the immediate TA ones we're buying, they are already existing. They say new build is certainly for the social and affordable rent, so where we can hopefully move them on from a TA position, that's the position. There are some that we are buying a TA, so I think there are some 4-bed houses that were actually not quite brand new, but are quite new. So it's almost what's in the market and what's available that we can find and purchase. That's often what drives what we can get.
So have you had those talks with the head of planning, Rob Jarman, to say if you have a small developer come forward with, say, 5 homes, that we may be interested? Because I asked because literally had a conversation with a developer on Monday, and that conversation hadn't been put across that we possibly as a council would be interested.
Again, we'd need to see the houses and so forth. I can chat to Rob and get him to chat internally, because who leads on the actual house purchases. You know, if there is the right house with the right price, then yeah, we will consider it. So yeah.
So I think we're thinking outside the box, Councillor Wilby, whenever we can, to facilitate our own properties, which I think is the right thing to do. We have more control over it then. Do we agree the recommendations and accept the third quarter finance report updates? Is that agreed? Thank you, everyone. And now we're on to the new key performance indicators, page 71 to 78, and the recommendation is on page 71. And Carly, you're on.
Thank you, Chair. So the report sets out the draft list of KPIs for the 25-26 year. We've obviously reviewed the KPIs, and they're presented under each priority area of the new emerging corporate strategy. Obviously, KPIs ensure that we transparently monitor and oversee the Council's progress against these priority areas, and this committee is reminded that performance indicators continue to be updated and published on the Council's KPI dashboard, accessed via the website for public as well. And we also complement that with a half-yearly and annual report on the performance position. The KPIs are set out in the appendix. There are 20 that are being proposed that fall under this policy advisory committee. The majority of those do fall under the corporate priority of quality homes, with 5 falling under the resilient communities priority 2. The appendix also details which portfolio each KPI sits under, as well as other details about frequency and whether the indicator will be targeted or just provided for context or information only. And of the 20 that are proposed, 9 are completely new KPIs, and 11 have been previously reported either to this committee or another. And then the recommendation sets out that you are to propose the new set of KPIs to Cabinet, but welcome any additional indicators as suggested by the committee.
Thank you very much, Carly. And can I just ask everyone, me included, to pop over and go and access that site so we can look at KPIs. And also, we've asked for this, so it's incumbent on us to go and look at that information. You may be making a rod for your officers' backs, but if we go and access it, then it gives us a better idea, and that appendix is actually really helpful about which officer is responsible, because sometimes, especially when you're a new councillor, well, even an older one, like all, you know, some of us, or medium served, you know, getting hold of the right officer, we can be very naughty and just go to an officer we know and go, who's responsible for this? When actually, that list is actually very, very useful. But please, everyone, go over and look, and the public actually, because you pay your council tax, And if you want to know what we're doing, go and access the information that's available. It's incumbent on you to do that. Anyone got any comments? So Councillor Kadaka and then Councillor Wilby.
Thank you, Madam Chair. First of all, I do remember talking about the dashboard doing the online, so it's good to see it's now in the off the ground, it's running. There's a couple of the IT administration things we may have to just tidy up, which I'm more than happy to send you the email, Carly, separately. The one thing I picked up is 2.3. It says about the monthly update. I do not think it's quite monthly because last update I could see the December 2024 and some data is January 25. So probably some data is still coming through. I don't know. The other thing is we do have the really quite comprehensive data, which is really, really good. However, when you got the target, not necessarily all the pillars got the target. So you got to peer all the data coming in, but you don't know, is that good enough? We're doing good or bad? So I think that's probably more data we get, we can build up those targets. But it will be good to have those sort of the targets, so at least the resident can see and can make the mind say, oh, we're doing good or we're not doing good. Thank you.
Councillor Wilby.
Yes, thank you, Chair. Just almost on the 2 points we just mentioned, I've just seen the last 2 lines, and it's got about the number of completed built units delivered affordable homes, which is great. However, how are we judging that? Because we've just got TBC, so is that just a target or data? Why has it been left as TBC?
So at the time of pulling together the appendix, this was a new one that was created. Not sure whether or not a target will be set against that for the year when we discuss that with the officer, but if we've got that information, once we have, that will be circulated to the committee.
Adrian.
Just on that one, I think it's partly to do with the build process. So if you say you take Maidstone East, we will suddenly have a good year when we go 180 flats. Then we might have 6 months or a year while we're building the next one, which makes it really hard to, I think, really give a target. Which I think, so that's part of the debate we'll need to have internally, just go, how best do we provide that sort of update so you know what we're doing on that, either on the build or what the plan is to make sure we've got the land or the other bits to build or create those new homes, I think.
Yeah, I'm aware sometimes with KPIs they can get smudged with, obviously, we're at the mercy of the builders as such, how quick they build. I still think that sometimes having a target to aim for is always a better way, and then the explanation why you haven't hit the KPI. I have to answer quite a lot of that within my job, to your truth, and sometimes it's, well, this hasn't happened, so I can't perform, or I haven't done this, or this hasn't happened because, and so on. But I understand trying to get to that kind of point, but I would suggest a target would be the better way to say, rather than just data.
With some of the new indicators as well, sometimes if we can't quite get to where we need to within the first year, it's good to have it untargeted for the first year, so then you can see you've got the data gathered, so then you can work out the best approach to that, to what that indicator might look like. So whether you're putting is it a quarterly target, or is it a 6 monthly, or is it something that is it cumulative? So I think we need to talk with the service to try and establish what is the best, because we don't want to set ourselves up to fail either.
Which I would probably suggest aim low, so that if you do then come in higher, it sounds really bad, but sometimes you have to be realistic about where you can get, and I think actually that may be a better way to go, especially the housing targets. Thank you.
And I would just like to say from the chair, for the record, for our millions of YouTube viewers, these are houses that Maidstone Borough Council is building for local people, and Lewisham and London boroughs are not buying them, renting them, taking them or anything. And I want that on an official record, because we are sick of putting down these actual rumours about Springfield and Maidstone East. These are locally built houses for local people, so please stop it on Facebook. Adrian.
Sorry, just a small note on that, just to support that. That's why the recent climate change meeting, it was agreed that we'd create the housing revenue account, so they would stay in Maystone's own hands and therefore in our own control. So therefore, again, just supporting what you're doing in terms of it's for Maidstone as much as possible.
I think that's really important because it's been deeply frustrating for councillors of all political persuasions that you feel as though you're hitting your head on a brick wall. And I feel that Lewisham Council especially, people seem to think they're run by oligarchs who have millions of pounds stashed away. I'm sure they'd love to as a council, but do you want to speak, Councillor Ford?
Just one quick one. I think so 7.2, once the data's been collected at the first quarter next year, it'll be emailed to the cabinet and committee members. I wonder if we should put it as an agenda item on the first meeting of that year, because then it can be discussed rather than just email us all.
Well, from the chair, I have no objections to that going on the agenda. I think it's a useful idea. And I know sometimes, Carly, it can feel when you're doing KPIs, are people just looking at the email and doing nothing with it, when actually it's a really important performance, it's evidence-based, and it allows us to challenge back. Are you happy? Because I'm conscious at the moment with Devo and everything that there is lots of work, extra work heading people's way. Is that something you would be able to do?
Yep, that's fine.
Anna, sorry.
Sorry, I just wanted to add as well, and as a reminder, you've got the data coming in. The idea of doing this was so that you had access to that data, not just when we gave it to you, as you very pleased my heart to see you talking so wonderfully about it, but also you can use that to inform your discussions with officers when they come to present on your reports, and you can ask the heads of service and managers to come and talk about the data at any point throughout the year. So the idea was this dashboard gives you regular information to inform your discussions.
So, a pain in the neck, I know, but just because we've had this discussion about the data today, I know we've all had an email with the link on. It may be an opportune moment to resend that link out to all members with a little reminder. It's election season. People will be looking at it in their droves, Anna. So strike while the iron is hot. Able to do that, Anna?
Yeah, absolutely, yeah.
Thank you very much. Right, if there are no further questions, can we agree the recommendations and accept the new draft key performance indicators with our thanks to the officers for all the work they've put into that? Agreed. Thank you. There being no further business and Liverpool are playing PSG at home, I now declare this meeting closed. And thank you, everyone.